welcome to the Simulation Learning Center at Sacramento State University. I'm Brad Stocker, Professor of Physical Therapy. You're here today to treat Mr. Sam Sim. He was admitted about 48 hours ago with a myocardial infarction, which turned out to be a small anterior infarction. His recovery has been uncomplicated. He's had no arrhythmias, no desaturations, no hypotension, and really no symptoms to speak of in the last 48 hours. As a result, the onset of any complications at this point would be reason to terminate physical activity. Mr. Sim was seen by a therapist this morning and successfully completed bed exercises in the position you find him now, semi-reclined. Mr. Sim was hoping this afternoon that we'd be able to do bed exercises with him again in the semi-reclined position, as well as attempt to sit him on the side of the bed and once again do bed exercises. Your task today is to come in to see Mr. Sim and do bed exercises in the semi-reclined and seated position. You'll be asked to treat Mr. Sim 3 times today. Treat each treatment separate and individually, as though the other 2 have not occurred. You'll be asked to perform bed exercises in semi-reclined and in the seated position in each case. Each scenario ends with returning Mr. Sim to bed, either because he completed the bed exercises in sitting or because he became intolerant to the treatment and was needed to return to bed. If you see the development of signs or symptoms in Mr. Sim, you should respond appropriately. After completing the 3rd scenario, you will be debriefed about the scenarios, and after debriefing, you'll be asked to come in and see Mr. Sim a 3rd time. At this point, I'd like to demonstrate a treatment for Mr. Sim as though you were the person providing the treatment. I'm here to demonstrate treatment for Mr. Sam Sim. As mentioned previously, Mr. Sim had a small anterior myocardial infarction approximately 48 hours ago, and his course since then has been relatively uncomplicated. Mr. Sim is hopeful of doing bed exercises today, and I'm going to show you how we would like you to treat Mr. Sim in this particular setting. Mr. Sim, how are you feeling this afternoon?
Great.
All right. Everything looks good on the monitor. His heart rate's about 82, his blood pressure steady, saturation level's about 98%, so we're in pretty good shape. So how about we go ahead and begin some exercise, Mr. Sim?
Oh, good.
Now, simulation is a little bit different from the perspective of the patient's clearly not doing the exercises, that we're simulating the exercise. What we'd like you to do is 10 repetitions of exercise for one upper extremity, in this case the right, as I'm doing. Following the 10 repetitions, as appropriate, you should look at the monitor and check with the client to ensure everything is still appropriate for proceeding. So how are you feeling, Mr. Sim?
I'm feeling just fine.
Okay, no significant changes in the heart rate, the ECG, the blood pressure or saturation, so I'm going to go ahead and sit you up on the side of the bed, Mr. Sim.
Sounds good.
Okay, so let's get the covers off your legs. And we'll get some draping done here. And I think we're about ready to go. Are you ready, Mr. Sim?
Yes, I am.
Okay. So once again, just like with the exercises, the transfer's basically maximum because he is a robot, a mannequin, and not truly a patient, semi-healthy. So we're just going to spin you up here, Mr. Sim, and sit you on the side of the table. Excellent. Now, look me in the eye and tell me how you're feeling.
I feel just the same.
Very good. Very good. So I'm going to sit you here for a moment, make sure your heart rate's doing fine and the ECG looks good, blood pressure and saturation, everything looks good. So how about we repeat that exercise again, all right?
Okay.
So, once again, you're going to do the same exercise, just 10 repetitions on one upper extremity. Oh, How are you doing there, Mr. Sim?
Doing great.
Okay, that's all we're going to do for you today. So in this particular instance, Mr. Sim did very well. No onset of symptoms, no changes in his physiological signs, and so that's completing one treatment, and at this point I'm going to return Mr. Sim to bed. Now I will straighten things out, but not completely put him back to bed, because now I'm ready to begin my second treatment, and I'm simply going to wait for the simulationist to speak from above to me and let me know when they're ready to begin the second treatment session.
End of simulation 1, starting simulation 2.
Now, at this point, I'm going to begin my second treatment just as I did the previous time, saying hello to Mr. Sim and beginning with upper extremity exercises in this position. Please recognize that we're going to ask you to do this 3 times, and each time should be treated separately and independently. In some instances, Mr. Sim may tolerate the treatment perfectly well with no signs or symptoms on the monitor or that he expresses. At other times, Mr. Sim may show a change on his physiological monitor, or he may report the presence of symptoms. If he does that, then you should respond appropriately and professionally. If he does not, and he tolerates the treatment, then after doing the exercises in sitting, you should return him to bed as I did. However, if he develops signs and symptoms, you respond appropriately, and each scenario ends by putting Mr. Sim back in bed like this, alerting the simulationist that you have completed treatment at that point in time, and they'll let you know when to set things up and begin again. Thank you for participating in this project with us today. My students and I both wish to thank you greatly for your time and your commitment to this, and we hope you enjoy the experience and that you learn something from it. Thank you for participating.